Okay, good afternoon to everyone. Welcome to the NORDIC Health the Amplified Nurse solution presentation. My name is Nika. I'm from Innovation Norway. And for today's session, we have three companies. Starting at 3 p.m. we have RoomMate, at 4 p.m. with Sonitor, and at 5 p.m. we have Hubert. So please stay on to listen on to the other presentation as well. And for tomorrow, 4 p.m., we have two sessions at 4 p.m. and 5 p.m. At 4 p.m., we move sensors, and at 5 p.m. will be thermal scan. So the presentation structure will be 30 minutes of presentation and demonstration, and followed by 15 minutes of Q&A. So the presentation have started yesterday and all the way up to the 15th of June. So if you want, you can sign up here at the link. It's free. Please encourage your friends and colleagues to sign on as well. If you're unable to attend the session, please still do sign up as well, because we can then send you the recorded session on YouTube. If there are any challenges that you are facing that is not covered in this series of solutions, please write to me. I can continue to look out for solutions. So my name is Nika. I'm from Innovation Norway, and here's my phone number and also my email. So a total of 17 companies from Nordic, that is Norway, Sweden, and Finland, are providing solutions targeting to help the nurses in their day-to-day work. So these are the remaining companies. So without much ado, let me hand over to Sven Seljum from RoomMate. Sven will be sharing today. So I will stop my sharing. Sven, the time is yours.
Thank you so much, Nika, and thank you for the invitation and the opportunity to present our solution for a Singaporean market. And so thank you both to Innovation Norway and Business Sweden and Business Finland for this opportunity. So I will show you a well-proven and mature technology that has been in use in Scandinavian countries for several years. And it's a solution for digital supervision and monitoring. So hopefully you can see my presentation now.
Yes.
Yes, and you can also see my contact information here on the first slide if you want to share this with the participants later. So as you may know, physical monitoring of patients is something that is quite resourceful and takes up a lot of resources from the organizations. It means that you might be able to be at the patients when something has happened, but probably you will not be there when something happens. And physical monitoring of patients is something that causes stress and insecurity for staff and patients alike, especially for night staff. We have seen that this is a huge toll on their work. Of course, it also means that when you do physical monitoring of patients, it also it's a reduced sleep quality and a slow recovery for the patients who are monitored during the night. I have actually talked with hospitals that or care homes that do a physical monitoring every 30 minutes during the night, and of course that takes a huge toll on the sleep quality. And it also invites the private space of the patient. And lately, everything has escalated. And this is a quite common picture, I think, from most countries with a hospital system like yours and ours in Europe. There's been an increased number of patients. It's an increased number of safety precautions against the pandemic. Recruitment problems has escalated hugely. And we see a lot of burnout and stress-related sick leaves. So what we are proposing is a way to do a digital transformation of the care work. And we see this because the importance is because the resources are depleted. There is very hard to recruit health professionals, and the workload of health professionals is much too high. And you spend a lot of time on non-productive tasks like running from room to room, when there's basically no need for you. And fall rate is very high in hospital and care homes. This is something that is similar in all countries that monitor these things. It's an increased demand for services as well among the population. And of course, quality and traceability is also important as people and patients get more demanding. So what could health service be what would health service look like if as a nurse you can tell that the patient is safe in bed without actually going into the room? What if the nurse can be alerted when the patient sits up in bed and can reach them before they get out of the bed and falls? What if the nurses would know when patients don't come back from the toilet during the night? And what if nurses would know if patients lie too still in bed or are moving sufficiently by themselves? This is occurring. This is of course something to do with pressure ulcers. And what if the nurses could know all of the above at the same time while maintaining patient privacy? So this is the thing that we are addressing, and how we can do digital transformation. So the way we can do this is by using this sensor, as you can see here up in the corner. I'll try and put on the laser pointer. So this is the actual sensor, the RoomMate sensor that sits in the patient's room. We have more than 4,500 active users currently in hospitals, in home care, in care homes, and in assisted living. And we are experiencing huge growth at the moment, so we expect to have more than 8,000 active sensors by the end of this year. It's a Norwegian solution, and it's developed and produced in Norway. It's very easy to install, and it's very easy to use for health professionals. You don't need an IT degree to be able to use the system and configure it for individual use. Alarms and notification is delivered directly to a smartphone or tablet, as we can see here. So this is a screenshot from a situation where the sensor has detected a fall. And we will have this demonstrated later, but as you might see from the picture here, it's a very anonymized image of the room. So the thing here is not to show any detailed image of the patient or the patient's room. It's just to show that the patient has fallen, and we do this in an anonymized way, as you can see here. So sensor is an infrared light sensor that creates a 3D vision of the room, so it's not a camera in any sense. And the image is processed and made on the sensor itself. It has an integrated microphone and loudspeaker, so you can actually talk to the patient as well. And it connects to the nurse's phone or tablet via Wi-Fi or internet. So in this sensor, there's a lot of different functions, and it is a digital supervision with a depersonalized 3D sensor. It has fall detection without any wearables on the patient. It's just a sensor sitting on the wall that can detect falls, and it can detect all types of falls, even very slow falls, which is very hard to detect with traditional fall sensors. It can know about what's going on in the room, in the sense that the patient goes into the toilet and doesn't come back, or if the patient leaves the room or somebody comes into the room at a time when that's not supposed to happen. So one use case for this is maybe if you have confused dementia patients that might cause harm to others, it's very important to know if they are leaving the room during the night. The sensor can detect if the user sits up in bed, which is very helpful when it comes to preventing falls, and we have great results in this from hospitals and care homes alike. We can know if the patient leaves his chair or sofa, if walking around, or like we said, is falling. And also if the patient shouts for help, the sensor can detect that and can alert the care staff. And there is a two-way speech communication solution. So the alarms are set up individually in a very easy to use way. So we can see that in this particular room, there is a lot of alarms set up. And this patient also has a common wrist button for extra safety, which is also very easy to connect to the system. So we can set up individually when the alarm should be active and for what time period. And for sometimes we would maybe put in a delay, so everything can be set up very individually, very easily for the different patients. So what you need to do is to mark up the room very easily. You draw a line here in front of the door. You put a dot on the chair to mark the chair, and you draw a square around the bed. This is all something that the nurses can do on the fly. So if, let's say, if the room changes configuration, or if you move the bed a little bit, or if you move the chair because it's more convenient for the patient, you can very easily set up the alarms again later. So even in a hospital where patients change quickly, it's very easy to change the alarms and to change the configuration of the room. So typically you will use the anonymized images, but you can also have a more detailed image of the room, which is in no way an HD image. It's not a high quality image, so it's not used to check on respiration and things like that, but it can give you a better view of what's going on in the room based on the individual's needs. So the user interface for the nurses is very simple and intuitive to learn. And once you log in, you will actually have access also to training videos from the front screen, as we can see here. We can give different types of alarms, so that you have one type of alarm, which is a red alert, like for instance a fall, which means that you need to react immediately. But there can also be yellow alerts that tells you if a patient maybe leaves the room or does something that doesn't require immediate action. So if there is an alarm, the sensor will send an image, but that image will only be visible at the time you are dealing with the alarm. So once the alarm case is handled, the image will then be truncated, it will be gone, it will not be kept anywhere. But what will happen is that everything that has been done in the system will be logged in an audit trail. So we can always see who did what with which patient at what time and for how long. In the common room for the nurses, you can have this RoomMate dashboard, which shows you the status of all the rooms at a glance. And we can see from here there are several rooms where the patient is lying in bed. In this room, there are several persons present. In this room, the patient is sitting in the chair. There are 3 rooms with active yellow alerts. Okay, it means that in these cases, there's one left the room and a couple has pressed alarm buttons. And in this room, there is actually an active fall alarm. So this is very helpful when it comes to keeping overview of the whole ward, for instance, during the night, or the whole wing, or basically as many as you like. And you can add these kind of active sensors also to the RoomMate sensor. So in addition to all the things that the RoomMate sensor can detect by itself, you can attach motion sensors, pull cords, panic buttons, and wristbands, pendants with an alarm button. So it's just to increase the ways that the patient can call for help. And this is done. These are added to the sensor wirelessly, and they are battery operated. So it's very easy to set up and take advantage of these things. So this is the way to try and explain what digital first means if you do a digital transformation of how you provide care. So let's think that an alarm is coming in from the sensor. So the staff can then see what type of alarm it is, and it says in the text message what has happened. And if that is sufficient information for the staff, well, then the situation is handled and the alarm should be checked. But then the staff can also see an anonymized snapshot of the incident, still on their phone, still working digital. So if this snapshot gives sufficient information, then they can handle the alarm and the situation is checked. But if that's not sufficient, they can still work digitally by doing a digital supervision and view an anonymized image stream from the room. And again, if this is sufficient, then everything is handled and we are still working digital. And then you can also do a visual and auditory supervision, you can actually talk to the patient and check if everything is okay. Have they actually fallen? Do they need help? We are still working digitally, and we might be able to check the alarm just by doing this. But if this still isn't enough, well, then you do a physical supervision. So then you have to do something physical. But before that, you can do all these things and still be working digitally and taking the advantage of a digital way of working. So just to give you an example of what kind of benefits you could expect, and this is from examples from the Nordics, but I'm very sure that we would see the same in Singapore based on my knowledge of how you work. So in one particular care home, they had 40 rooms, and they could reduce the night staff by 1.8 FTEs. One hospital in Norway have reduced the number of falls they have seen in their department and the need for extra staff to take care of people with fall risk, which has led to a cost saving of more than 105 million Norwegian kroner, which is approximately 15 million Singapore dollars. They experience that patients sleep better, which reduce, again, hospital time, delirium situation, and medication. It reduces the stress of the care workers to a huge scale, so that actually people who have been burned out, stressed, or actually very happy to back to, because they experience that with the RoomMate solution, it's so less for them to do the care. If we have valuable time, we can reserve for acute conditions or even, for instance, medication administration during the night, because you can feel sure that the patients are looked after. Yes, so by that I will do a quick demonstration. So I will have my my colleague going into the room, and I will then bring up the RoomMate app, which looks like this when you are working as a nurse. So I will open up a anonymized view room. Hi, Cecilia. So yes, could you please enter the room now? So as you can see here, the person is coming into the room and walks about, and it's in a very anonymized image. If I go back to the status view, I can see that there is now an active alert coming, because there is an alert going for this room when somebody enters the room. And by pressing this, I can see this alert, and I can also get a still image of the situation and also with a detailed image. So because I know that everything is okay here, I can check this alert and go back to the list. So, but let's see what happens if Cecilia falls on the floor. So if you might do that, Cecilia. So I will go back here, and I will have an alarm on in my app that says that there's someone fallen, and I can see now it's blinking red. So by pressing this, I can go in and check what's actually going on in the room, and I can see there is an image here. It looks like she has fallen, and I can then decide if I want to talk with her, or I can also listen into the room to check what's going on. Or in this case, if this was a care home, I would probably just go into her room and check on her. So thank you for that, Cecilia. You may be excused. Yes, please. Okay. Yeah, you can lie down in bed for a while. So as we can see now, the symbol of the room also changes to give you a status view of what's going on in the room at that time. And now we can see that she's lying in her bed. So let's see what happens if you sit up in bed. Cecilia. So we can now see that it's an alert couple and a changes from someone who is sitting up in bed, and we now have this image. And what I could do now is to go. I could go into her room and help her before she gets on the floor and falls over. So this is just to give you a quick view of what the RoomMate solution looks like for the nurses and the ease of use for it. So thank you very much, Cecilia. That is all. Bye bye. Yes, so hopefully that's given you an impression of the RoomMate solution.
Thank you, Sven. So very interesting and very impressive demonstration. So I think now it's open up to the floor. If you have any question for Sven, you can unmute yourself or you can actually type it in the chat.
Sorry, I missed the earlier part. Can I just confirm the reduction of manpower the night shift to 1.8? How do you calculate that?
Well, it depends, of course, how many you have from before. I mean, what is your goal? What do you want to achieve? But in this case, I think they went from 5 night staff to yeah, what is it? 2.1.8. Yeah, 1.8. So they reduced from 5 to 3.2. So it depends on what you want to achieve, and of course how many you have from before. But we have seen the same kind of the type of figures from other departments. But it depends, of course, how low you are in manning from before. So some places might already be cut to the bone. But anyway, it gives you an impression that at least our experience has been that at least some care homes have been able to reduce the number of night staff by almost 50%.
No, thank you.
But I think that the main focus perhaps also should be on the quality of this, and of course the quality of work, the job satisfaction from the nurses is so much higher when they feel that they are safe.
Hi, Sven. We have another question from Sadia. She was saying, could you explain on the installation of this device? How can you advise on its usage for a 8-bedder cubicle? That means a multi-bedder kind of ward where there are 8 beds. Yeah.
Yes, it could certainly be so that you have one RoomMate sensor for each bed. It depends a little bit on how close they are together, because the sensors should ideally be in a position where they could see only one bed at a time, and also not interfere with each other. But if you have rooms where there is a separation, where there is a curtain between the beds, you could I would assume, I will have to check on it a little bit more detail to see the drawings of the room and so forth. But we have experience with several sensors in one room, and the sensor basically needs power and an internet connection, which could be both the Wi-Fi and the cabled connection.
Sven, to add on to that, I believe that you mentioned also that your solution has been used in this care homes, which are generally multi-bedder, right? So that has been tested in a multi-bedder environment.
Yes, it has. But again, if the room is quite small, so that the sensor will interfere with each other, it can be tricky. But we can also adjust the frequency that each sensor uses so that they don't interfere with each other. But you know, it's a little bit hard to just promise here and now that yes, you can install eight next to each other, because it depends a little bit on the room and the room configuration. But and also, you know, the use. I mean, if you want to monitor all the beds for the same things tipping up during the night, you would need that the sensors could see the bed without interference. So I cannot just say, you know, carte blanche that it will work in every situation in so many with so many beds, but it probably would.
Yeah, maybe it would be good
sorry.
Yeah, maybe it'll be good to let the audience know that actually we are working on bringing in samples into Singapore. So Sven will be sending me some of these RoomMate sensors. So if any of you are interested, please drop me an email. We can actually do a live demo, and then also can look at your site to see how can we do a pilot to test out the effectiveness of the system.
Yeah.
Hello, thanks for the sharing. Yeah, actually, I just wanted to ask because there is a slide on marking out the room. So for installation, do we have to do any like object mapping, or will the room be automatically, the images be automatically captured by the sensor?
Yes, you need to do that marking that I showed you. You need to just, you know, tell the sensor where the door is if you want to use that alarm, and you have to tell the sensor where the bed is too if you want to use that alarm, the alarms for the bed. But that is something that you easily do from the interface itself, and it takes just a few seconds.
I see. Okay, thank you.
So we have had very good testimonials from nurses that actually is very happy about the ease of use and how easy it is to do the configuration, and how reassuring it is for them also to be able to make sure that everything works as it should, that they really trust the app because they do everything themselves. So there's nothing that an outside technician or a support division does. They do actually everything themselves, and that makes it very confident for them.
So Sven, you also mentioned earlier that there are up to 5,000, and probably by end of the year will be another probably up to 8,000 installation. Can you share generally what is the spread of installation between hospitals and also the homes?
Yes, I would say that at present there is definitely most in care homes, and I would say that I would think by the end of the year it will probably be around 70% will be in care homes. 10% will be in hospitals, and around 20% would be in private homes. So when I say care homes, that is the broadest sense of the word. I mean, it's all kind of institutions, but mainly assisted living facilities and care homes for the elderly.
And sorry, one more question. Is the mapping done via the dashboard, or is there any app that we need to access?
No, it's done via the dashboard.
Okay, thank you.
Yeah.
So Sven, you also showed just now that it can be on the iPad or on the iPhone, right?
Yes.
You can even
Android,
do the setting on
iPhone, tablet, PC.
Do we have any more questions? Okay, while we continue to think about the questions, maybe I can share some more information here. You can see my slide. Okay. As I mentioned earlier, you have any more information that you require, or you want to see a live demo, you can contact me at this email, Nicole, link at Innovation Norway. So I will follow up with the questions or the demo, which will likely to be coming in sometime in late June or July. So if there's no more question, then I would like to mention about the next session will be tomorrow. That there will be 2 sessions there, 4 and 5 p.m. One from MOOC sensors and the other one from thermal scan. So if no more questions, we will end the session today. But remember, you can always come to me for any questions. And all these sessions, the video are recorded. I understand some of you have come in slightly late just now. Not to worry. I will send out the YouTube link to you so that you can actually watch the full session.
Maybe we just can add, Nicara, that if somebody would like to try this, we are very open to pilots at a cost-free, risk-free agreement, so that we can we will actually provide you sensors for a certain amount of time for you yourself to assess the benefits you can achieve with RoomMate. So that is something that is very easy to do, and you basically don't risk anything. So unless you could decide to continue with it, you won't pay anything.
Yes, I did have already received inquiry from hospital to do a testing in their ward. Yeah, so we'll be looking forward to that. So if there's any more requests, you can just come to me, then we can just arrange it accordingly. Okay, thanks everybody. Hope to see you in the next session. Thank you. Bye.
Bye-bye.